We begin by demonstrating proper surgical attire, which includes hat, mask, goggles, scrub suit. When we enter the surgical suite, we obtain a sterile gown and glove pack. The first thing we're going to do is set the glove pack aside and check our sterile gown pack for sterility. We check to make sure that the gown pack has been sterilized. There is a sterile sticker that will remain on the pack. There is also an expiration date if your hospital has expiration. There is also a load number for the load that this has been sterilized in this gown. You'll also see that the autoclave tape indicates that this package has been through an autoclave. Also check to make sure that the package has been wrapped properly, that there are no edges sticking out, and that the package is not wet. This is called the integrity of the pack. Every time you open a sterile pack in surgery, you must check the integrity of the pack. Now the gown will be placed in front of you on a flat surface, and the gown will be opened away from you first, then side to side, right or left, and then towards you last. Now making sure that you don't at any time cross over this sterile field. We've created a sterile field in the middle of this package. 3 inches along the outside edge of the entire package is considered unsterile because of the wrapping process. Now we're going to begin by opening our glove pack in a thumb-to-thumb type manner, and we're going to peel it down. It's a peel pack, and this package comes from the company already sterilized. I'm going to peel it down about halfway and then approach our gown and flip the gloves on top of the gown, creating a sterile barrier over our arm. And then we're going to step away from our pack. We are now ready to begin our 5-minute surgical scrub. First, we're going to check to make sure that we have all the supplies that we need to begin our scrub. We have betadine, we have a scrub brush, we have a sink, and we have a clock for our time scrub. First, she has to open her brush pack. And again, with a peel pack motion, she's going to peel it open, thumb to thumb, and put the flap underneath the scrub brush and place it next to the sink. She's going to wet her hands and arms and begin with a pre-wash. Now, the pre-wash is used just to remove gross bacteria. If you were out gardening or working on your car last night, this is just a very quick pre-wash. It's not timed. You're going to get a little soap on your hand, create a lather, and scrub your hands and up your arms to 2 inches above the elbow. And again, this is not timed. Just reduce bacteria. When the pre-wash is completed, the nail file is obtained from the pack, and your fingernails are cleaned underneath the running water. Very important that you do this under the running water so that any debris will rinse into the sink. When the fingernails are complete, just drop the nail cleaner directly into the sink, and we're ready to begin our timed portion of the scrub. She's going to rinse, and note when she rinses, she always starts at her hands and works her way up to the elbow. Hands are positioned up in the air, elbows down. She's going to grasp her sponge and begin by scrubbing her fingernails for 30 seconds. You're going to be scrubbing one hand and arm at a time, so you're not going back and forth from one hand to the other. 30 seconds on the fingernails. When 30 seconds is completed on the fingernails, we start with the fingers and the thumb of the hand, doing all 4 sides and also the web space in between the fingers. Now, when the fingers are complete, 30 seconds, we move to the palm for 15 seconds. Small circular motions. Remember, not going back to the fingers because the fingers have already been scrubbed. 15 seconds on the palm, and then 15 seconds on the back side of the hand. Once this is complete, we're going to work down the arm with small circular motions all the way around the arm for 1 minute, paying strict attention to the time because we can be scrubbing one area for a short period and then get to the elbow and still have 45 seconds left. So make sure that you watch your time on your arm. Make sure that you let the brush do the work for you so that you don't have a lot of motion in the arm that is being scrubbed, because that has more tendency then to drop your hand or more tendency for contamination. Now, before we go to the next hand and arm, we must rinse the brush. It's very important you rinse the brush and then exchange the brush to the opposite hand and begin again 30 seconds on the fingernails, 30 seconds on the fingers, all four sides, including the web space. Now, at any time during this scrub, if contamination occurs, if you touch the faucet, if you touch the sink, or any type of contamination occurs, you must start over with your entire 5-minute scrub again. Don't ever scrub over an area that has already been scrubbed. And small circular motions will be moving down the arm to 2 inches above the elbow. Also maintaining that the hand stays up and the elbow down. Also, make sure that when you're scrubbing, you stay far enough away from the faucet that your hands are not going to hit the faucet at any time. When the minute is completed, the brush will be dropped into the sink and she will start rinsing. Notice the motion when she rinses, going in one direction only, never going back through the water once she's rinsed. Step back and rinse the second hand. Now, you can rinse as many times as necessary in order to remove the soap, but just make sure that once you have rinsed, your hand and arm go back up again. Never dip your hand down so that the water is always draining from the elbows. Do not shake your hands. And now we're going to dry our hands. She will begin by approaching her sterile field. She's going to grasp onto her sterile towel and lift it up and away from the package, allowing the gloves to slide back down onto the gown. The towel will fall open and she will dry one hand and arm at a time, beginning with the fingers, paying close attention to drying the fingers so that the gloves will go on easily for her. She works down the arm up until the elbow, making sure that when she's going up the arm, she bends so that the sterile towel does not touch her unsterile scrub suit. She's going to start on the other side now, hands, fingers, and up, bending, and through the towel, the arm moves. And at this point here, she drops the towel and her hands will remain up and she is surgically clean.